Hello, this is Anne DeGheest, and it's February the 19th, 2021, and this is an insight, the first video on the virus. Great, fantastic news. The US has dropped 69% since the peak in January. 12% of the population is getting vaccinated, and the world is starting to roll out the virus. You don't want to miss this first update. And please do not miss the second update with a lot of new information on the Pfizer and Moderna vaccine and some new efficacy data that are really important that you know. Let's get going on the first video. This is the first video on epidemiology, and we have a lot of good news. The US has dropped 69% since the peak in January. 12% of the US population has received at least one shot, and we're starting to reopen some of the high school for sports. So you can see the massive drop of the US. I mean, it's just the fastest drop of all countries. We'll talk a little bit about what maybe is going on. Europe also is on a great decline. South America and Brazil are pretty flat. And so let's take a look at what's happening. As a result of Europe and the US contracting, you can see the whole world has contracted. This is the first time we've seen this in a really long time. So finally, some great news. So on a worldwide basis, in the last 2 weeks since I've talked to you, we have dropped 24% on the number of cases and 17% on the death rate. Still 2.4 million people is a lot of people that have been lost, and we're not out of the woods yet. So let's look at where we have the mutation. This is where we have this mutation that we're 50 to 70% more infectious. And you can see all those countries took some drastic steps to trying to control it. And you can see United Kingdom, and we'll talk about them a little bit later on there, was really sky high in the highest rate per million. So these are all normalized data for their population there. The United States, as we mentioned, is also dropping. Brazil is flat, and South Africa, that had also the dangerous mutation there, has also dropped. So these are all great news. So hotspot with the US and the UK, both countries are controlling it. We're still not back to normal levels, so we still need to be cautious not to reopen too quickly. Whoops. Europe is doing what's called the whack-a-mole. The whack-a-mole means, if you remember, for the last several weeks, it was one country exploding and then controlling it, and then another one. So you had the peak moving from Italy that had that big black peak here, and then we had France that basically took off, and then we had Spain, and then we had the UK. I mean, it was a horrible situation in Europe. And you can see right now, most of the European countries have been able, for drastic restrictions, people could not really leave their house pretty much. They've been able to control it. France and the UK are starting to take some new policies. In France, they have decided to basically only give one shot for people who have been previously infected. And that's because the data seems to indicate that is enough of a booster that you only need one shot of the very precious vaccine from Pfizer and Moderna there. And the data is coming out from the Health HAS, which is the French health equivalent to our HHS in the US. And they've been able to show that they can really do the boosting and basically regain the immune memory that people have been infected by the virus. They have 3.4 million Frenchmen have been confirmed with COVID, which is, they had 81,000 people who have died, which is the 7th highest figure in the world. The good news is that we've started vaccinating in 92 countries worldwide. That's an incredible situation there, because remember, 4 weeks ago, we were just starting to get the first approval there. So, I mean, the biotech industry should be applauded, in my mind, even get a Nobel Prize, honestly, for what they've accomplished. Now, there are some differences. Israel is doing an incredible job in having vaccinated with at least one shot, at least 80% of their population there that's eligible. And UAE, which is a smaller population, is doing very well. Then the UK is way ahead of the US in at least having given some doses to their population there. And then you can see the world overall, which is a really big task of vaccinating 7 billion people there, has a long way to go. And we'll talk about some of the problems the EU is facing. As a percent of the population, you can see that Israel is looking at the daily vaccination of 1.5% of the population daily. I mean, that's massive. In comparison, The US is over here, and we're doing roughly 0.5% of the population daily. So we need to accelerate that, if we want to get to the 50 to 70% herd immunity target there. So Israel came in the news today in several cases. And let's see what happened to Israel. You can see Israel had like this really big swing in September and another huge one in January, one of the highest cases per million, much higher than the US and Europe as a whole. And so they took some really drastic action, and they made a deal with Pfizer to pay a premium for their vaccine in exchange of sharing data. And a lot of breakthroughs coming out of that. So to give you an idea, they already vaccinate around 80 to 90% of the people over the age of 60 years old. They have at least one dose. 80% have at least two doses, so they're fully vaccinated. So this is a population at the highest risk. They're doing a very good job at the next target, which is the 16 to 59 years old, where they have at least 40% of the population has at least one dose. What that means is that they are like a petri dish for us to examine how are the vaccine decreasing infection, and we'll talk more about that. The Israeli minister just released several studies, one of them today, showing that 1 week after the second dose of the Pfizer vaccine, they can see a drop of 94% of the number of cases. And the way they calculate that is that they had two groups of around 600,000 people there. And you can see they had a nice distribution also with people over the age of 60, which is the critical one we want to look at. And this group were compared with people who were equivalent. They were equivalent in their profile, which is the risk for infection based on what the type of work they had, the type of medical background they had in the overall health. And they basically start to show that after you had that vaccination, this is the big question mark we had, which there's a 94% drop in symptomatic. That means we're dropping the infection rate, although you may still carry the virus in your nose, and we'll talk more about that. You're basically much less infectious after you have been vaccinated there. And the numbers are staggering. You decrease asymptomatic infection there by 89% and symptomatic by 94%. That means we stop the spread. Maybe not 100%, but at least it has a big impact there. And so the other data just came out of Israel today is a big breakthrough. And it shows that after one dose, which was a big thing that European and the UK wanted to do, is to just use one dose because we're having such a shortage of the supply of the vaccine, that they calculate that after 15 days, during that period from 15 to 28 days, which is what they're keeping track of right now before the people got the second shot, is that the vaccine had an effectiveness of 85%. Now, after you get the second dose, it goes up to 95%. But that was great news, because that means that we'll talk about that in the second video, that initially when Pfizer filed with the FDA, they only show a 52% effectiveness after the first dose. But in real world, what they have shown is that, after the 2-week period after the first dose, before you get your second dose, you had a big impact in the reduction of getting sick. The other thing that was really great news is that 81% of that group had the UK variants, which tells you how that UK variant, which is the B117, has really started spreading around the world. And it shows that therefore that the vaccine of Pfizer is very effective for the B117, which is spreading in the US also. They also show a 75% reduction in infection. So after 2 weeks after the first dose, you start dropping your contagious rate. And that was the big question mark. We did not know. So it's very big breakthrough data there. And there's going to be more data coming out of Israel in the coming weeks. And it vindicated the UK approach that everybody was criticizing, where they wanted to delay the second dose for up to 12 weeks because they want to vaccinate as many people as possible. So instead of keeping half the dose in storage for the second dose, now we can give all the dose, which are in limited supply, to everybody. And you can delay the second dose when the supply, catches up with the demand. And so that just came out today. The other massive news is that they saw in Israel that if we kept the Pfizer vaccine in a normal freezer, it worked. It was not affecting its effectiveness. And that's a huge deal because we had a lot of restrictions in the type of facility that had a special freezer at minus 75 degrees Celsius that the vaccine was approved for. So the Pfizer has requested to the FDA a label change, which will also drastically improve the availability of the vaccine in the world for Pfizer, as opposed to special areas there like major academic centers that they may have the super freezer. So these are all great news today. So in the UK, you can see they were hit really, really hard with mortality. And so they are starting to do new things. They're the first country in the world that are going to do what's called a human challenge. And the human challenge is that they're going to take 90 healthy young volunteers. These are people between, I think, 20 to 30 years old. And we're going to expose them to COVID. And we're going to basically measure what is the amount of viral load that you need to get sick. Okay. And because that's a big question mark we don't have. So the UK has decided to take a little bit of risk with a young population that's not at risk to get severe COVID. The other thing that they start doing is a trial to mix and match, that you can mix different vaccines between the first and the second dose. Again, you're going to see Europe is having a huge shortage and access to the supply of the vaccine. And so they want to basically say, I'm going to use all the vaccines we have now and be able to have a different dose for the second vaccine. So the UK right now is pretty much in a shutdown. They've had over 100,000 deaths. They've closed the schools. All but essential shops are closed. Socializing, even outdoor, is banned. There's lower testing. And there's a very poor compliance. They're having problems with people who are not isolating themselves after they know they're sick. So there's a cultural issue there in the UK there. So, and people are not really good at controlling it. So in the US, remember I said you dropped 69% since the peak. In the last 2 weeks, we have an acceleration of the drop, which has been 44% drop in the last 2 weeks. And we were talking in numbers, daily numbers, there were over 200,000 there. And now we are at 72,000, still dropping. So these are fantastic news. As a result of that, you see the death rate has gone down. There's a 3 to 4 weeks delay. And then the hospitalization, thank God, is also going down. So these are all great trends. And we are somehow decreasing our testing. Part of that could be availability of the testing. But you can see that, we're seeing all the trends in all the right directions. To give you an idea in the number of cases, this is all normalized data, which is cases per 10,000 up to 100,000. This is where we were during the peak. We were like in the very dark colors. Florida has now dropped by half in their daily case rate. Most of the country is getting lighter and lighter colors there, and roughly between 50% drop. Or California has gone from 328,000 to 61,000. So these are massive drops, which is great to see. So it's across the country, pretty much. We still are not back to normal. I don't want people to, in the South in particular there, not to be complacent. We're talking about reopening and getting rid of the mask mandate. I mean, that we don't want the fourth wave. And the fourth wave is something that could happen there with some of this mutation there. So we need to be vigilant. The positivity rate has dropped. We haven't seen those colors in a long time. These are people who haven't seen a cases in the last 14 days. That's the gray color. We never saw that gray color for probably a couple of months there. So we're all trending in the right direction there. But you still have the Southeast still has a pretty good acute case of number of infections. So why is the US dropping? We clearly have an increased immunity going out from two factors. We've had 28 million people were confirmed cases. Now, it is expected we may be underestimating that between 2 to 4x. So I picked 3x as my middle number there. So we may have had 84 million Americans who have antibodies because they were infected, combination of symptomatic, asymptomatic. And the vaccination, we have 41 million people who have at least one dose as of today there. So the combination of these two effects, you have 120 million people who somehow have antibodies. And having that has a huge impact in slowing down the spread of the virus from person to person. We've had 3 surges so far, and we want to make sure there's not a 4th surge. We have a new head of the CDC, Dr. Rochelle Walensky, and she's pushing really hard. You're going to see in my second video to basically change the mask mandates and doing double masking, some of the things we talked a couple of weeks ago. We are still scaling up vaccination. We're at 1.6 million vaccination per day. And there's been historically a seasonality. If you look at the video I did 2 weeks ago in 1918 and 1958, there was that same drop in February before we had another increase in March. So we want to make sure it doesn't come back up. We have to keep an eye on that mutation there. With that B1351, which is a South African mutation there, can basically evade antibodies and reinfect people there. So we need to keep an eye. And there's a case of a Frenchman who had a mild COVID 4 months ago, got reinfected with the South African variant there, and now is intubated in the ICU. So let's keep an eye on that. So see, we're ramping up vaccination in the US. Right now, these data there are lower just because the problem in Texas, a lot of the shipment through the bad weather in Texas and the Northeast there have had an impact in the availability of the vaccine across the country there. So we may expect a down drip and then going back up starting in the coming weeks. So it's astonishing. We have 78 million doses that have been shipped. 59 million have been administered. 41 million people, 42 million people have at least 1 dose, and 17 million people now have been fully vaccinated there. You can see it's pretty much a split between Pfizer and Moderna. We're doing a good job of pretty much now have covered all the long-term care, which is where half the death rate was coming from, is the residents and the staff. So I think that's why you see the drop in mortality and the slowdown of the infection rate. My computer is playing games with me. So the state, this is the problem that every state has their rules, and you can see depending where you're physically located, we're vaccinating 75 years old and up, or we already started vaccinating 65 years old. Some people are putting the teacher in the second category group. Some people are putting the elderly in the second category there, and the essential workers. So you really have to look at new state regulation and even new county regulations. So the good news is that we're going to be deploying over 40,000 locations there, in addition to people opening up large sports stadium to do mass vaccination there. It's basically CVS, Walgreens, Walmarts, and a lot of the very big chains are rolling up, and you're going to see a big impact in the coming weeks that when the vaccines start to get available at your local pharmacy. So the same thing is happening on hospitalization. You can see some states like California have dropped 22%. 41 states are falling in hospitalization there. Some states, is rising in Alaska. And so clearly we may have passed the worst of the peak. My computer is playing tricks, sorry. So the hospitalization is going down, as we just discussed, but we still have a mortality. And to give you an idea, one of the peak was on February the 4th, we had 5,000 deaths. And so we still need to be humbled by the fact that 9 of the 10 deadliest days in US history were due to COVID. And we're probably going to pass 500,000 deaths next week. So it's a catastrophe as far on the US scale. So as a result of that, we now have calculated that the life expectancy in the US has dropped by 1 year. And that's for the white population there. But if you start looking at the Black population there, they have dropped from roughly by 2 to 3 years. Because they've had a higher mortality rate, and then the Hispanic population is over 2 years also there, not just because of the high mortality of COVID in those populations. California is dropped 85% from the January peak. We're leading the charge. I'll give you some of the data on the cases. Went from 41,000 daily cases to 7,000. The hospitalization has dropped from 22,000 to 8,000. The positive rate, which is really great news, has dropped from 14% at the peak to 3%. So these are, and the death rate is probably going to go down, but remember there's a 3 to 4 weeks delay. So we're still living, some of the people were hospitalized during the peak. So the dashboard on vaccination is doing great. We have administered around 7 million doses in California of at least 1 dose. And there's a disparity in who gets the vaccine. This is California, 32% of the population that is white has had already one shot of the vaccine there, as opposed to 2% or 3% for the Latino, for the Black population there. So I think one of the problems you're going to see across the world is access to different ethnicity and social demographics there. We've entered the phase 1B, which is people are over the age of 65, and we start going after the essential workers to help support the economy. So I think California going to see is only going to improve. And you can see in the hospitalization rate, the big problem, of course, were the dark colors there, which is the red, which is people over the age of 70 years old. That's why we had a really high mortality rate. And you can see that's the great news. You can see the massive drop here. Most of the drop in hospitalization were the 40 to 69 years old who were unfortunately thinking they were not at risk and did end up being hospitalized. And that's where we had the highest infection rate in the population there is in the younger age group. So good news today, Governor Newsom has announced that he wants to reopen the high school sports, and it's going to be in 27 counties. And these are for the states with less than 14 cases per 100,000 there. He's going to open up football, baseball, softball, soccer, and water polo and lacrosse. If you're into some of these high contact sports, like football and rugby and water polo, you will have to be tested weekly. And if you're in moderate sport, it's recommended, but it's not required. So still everybody has to wear face covering whenever possible there. I want to tell the parents here that the final decision is at the county level. So the fact, for example, that the state has allowed that doesn't mean that Santa Clara will allow it. And Santa Clara has one of the toughest guidelines there. So probably things will be decided in the coming days. So stay positive, test negative, and get vaccinated. And please look at my second video on the clinical update.